Hi everyone, I'm Mahesh Jayaraman, co-founder of Sepalika.com, and today we wanted to share an important piece of news from the Times of India in Mumbai today, where it clearly says that the current practice of putting people on blood pressure medication basis just one single reading, which means you go to the doctor's office, maybe you're feeling a little uneasy or it's a routine checkup, the doctor takes your blood pressure and maybe it's slightly high, let's say it's 150 by 90. And if based on just that one reading you get put on blood pressure medication, there is a 63% chance that if you had taken a second reading or a third reading, those would have come in the normal range and you wouldn't need blood pressure medication. Imagine the seriousness of that implication. People who begin to take blood pressure medication, we all know, need to take it for the rest of their lives. And you could be taking that based on just one reading, which is completely wrong. So in the good old days, the doctors, when they found that the first reading was out of range, would make you sit for 5 minutes, then take a second reading, and if needed, even a third reading before they diagnosed you as hypertensive. This is because the first reading could have errors because you've traveled to the clinic, maybe you're a little stressed, and of course the famous white coat syndrome, where just looking at a doctor pushes up our blood pressure by about 15-20 points. Therefore, always make sure that you get your blood pressure readings taken at least 3 times, especially when the first reading is out of range. But of course, at Sepalika, we specialize in giving you natural solutions to problems. So God forbid you do have high blood pressure, what can you do for it? Today I'm going to share a very, very powerful, simple acupressure technique that comes to us from the world of auriculotherapy. Auriculotherapy basically stands for ear acupressure. And this simple acupressure technique is something that you can do by yourself. Just need a thumb and an index finger, and we're going to use the top 1/3 of the ear. So what we're going to do is we're going to take our thumb and place it behind the ear and use the index finger, and we're going to massage with a good amount of pressure in the groove that is just behind the ear. So this is the top 1/3 of the ear, and we're going to be pressing this whole region with a lovely amount of pressure, and you will begin to feel the blood rush there. How will you know? So you get the sensation of heat, you get the sensation of the warmth that comes in that area, and that's how you will know that you have pressed this point correctly. In fact, even in the Varmam technique that I have learned from the Arts Research Institute in Coimbatore, one of the ways in which we make sure that we begin the day with a calm mind is by ensuring that we place our index finger in front of the ear and the thumb behind the ear, and you pull down gently. There are fantastic nerves and blood vessels from here that go directly to the brain, and they help calm you and help your parasympathetic nervous system, the one that calms you down, to work properly and to establish blood pressure again at the proper level. So go ahead, try it, give it at least a week, and the more you incorporate it into your normal daily practice, the more you will find that it gives you fantastic results. We wish you all vibrant health and well-being.